This is Radpod, a podcast produced by ASMERT, the Australian Society of Medical Imaging and Radiation Therapy. ASMERT acknowledges the Bunurong people as the traditional owners of the land from which we record this podcast and pays respect to elders past and present. Hello, I'm Steve Lacey and I'm the Director of Education for ASMERT. And when we're working with patients, I'd like to think we all do what we think is best for our patients. We try to follow best practice evidence that has been born out of well-documented research. We attend education sessions, conferences and team meetings to learn techniques from each other. But just how much is the patient involved in shaping the way that we practice? And do we listen to them enough to adapt our practice to suit them? Over recent years, the UK has made some significant changes to including the patient voice, which has had a profound effect on practice around the UK. And I'm honoured today to be joined by Charlotte Beardmore. Charlotte honestly does a little bit of everything, but more importantly, she's the Executive Director of Professional Policy with the Society and College of Radiographers in the UK. And in 2024, she received a Commander of the British Empire for her work during her career. Welcome to Radpod, Charlotte, and welcome to Australia.
Oh, thank you. Wonderful to be here.
That is an absolute massive achievement to be Commander of the British Empire, and I'm sure that was a very, very humbling experience for you.
Yeah, amazing. It still makes me sort of think, gosh, really? Me?
Yeah.
And I sort of accepted it on the basis of accepting it for our profession of radiography, because there are only so many awards given each year, twice a year. And for radiography to receive one, I just felt such a privilege.
It's also, I think, a really good way of recognising that profession. And I think that the fact that you've actually done it and thought about it in that light as well, I think that it's really much, I guess, a reflection on how much you really, really care about the profession itself and how much you really care about the way that we are actually heard as radiographers as well. So well done. Congratulations.
Oh, thank you.
Now, let's just start by talking about working in the UK. So what are some of the key issues and topics, and how does the society work and engage with their members?
I think the first issue that I would talk about is the workforce pressures, and that sounds a really negative one to start with. but
I'm sure we all feel the same though, right?
And I kind of want to get it out of the way, really.
Yeah.
That we know that there's increasing demand on imaging services and radiotherapy services. I mean, and it's positive to see the growth and development in imaging and how it's utilised now in so many patient pathways, in so many different ways. And radiographers, meeting patients, 9 out of 10 patients in an acute setting will see a radiographer.
Yeah.
So workforce challenges are huge, but it gives us a great opportunity, I think, to really think about how we can deliver services for patients differently through workforce transformation.
Yeah.
So we've been doing quite a lot of work within the Society and College of Radiographers on our education and career framework and how we can support radiographers really having a lifelong career, not just in clinical work, but to have progression in clinical work, but also in education, research, policy work as well, and to recognise the broad areas within which radiographers now work. So a lot of work focused on supporting education and training, but as you mentioned earlier, the research, the evidence base is hugely important to our profession. We cannot be a profession if we don't have an evidence base.
That's right, yeah.
And we know how much technology is changing, patient perspectives are changing.
Yeah.
That we need to invest in research. So we do quite a lot of work at the Society and College in offering research awards as well, with a strong 5-year research strategy, clear priorities, clear engagement of patients within that process.
Yeah.
And I guess the other areas we really help, we're a membership organisation just like ASMERT. So we're really trying to develop what we offer to our members in terms of learning opportunities. And I know you're doing some great work here in ASMERT, which I'm looking forward to hearing about with your learning and management system. Yeah. And so we're really trying in that space as well to provide tailorised learning for our members appropriate to the point and time in their career and the setting within which they're working. There's really so much to do. We haven't got enough capacity to deliver. You must feel the same.
Oh, we always feel the same. That's for sure. And I think that you mentioned before about kind of listening to your patients as well. And when you kind of think about it, that has been revolutionised, I guess. If you think back to 40, 50 years ago, we were very much about, the patient almost just said nothing, or we wouldn't listen to them at all. And then slowly over time, it's gotten more and more. And it's really kind of hit that point now that we're really having to listen to the patients to understand more about that kind of patient-centred care and including them. So for you, Charlotte, what's the importance of that patient voice in our daily practice?
I mean, we are trying to provide an excellent service, and we see things through our own professional eyes. We think, that makes sense. We'll deliver this imaging investigation or radiotherapy treatment in this way, or this education this way. But actually, is that resonating with what the patient's expectations are? And so I think being able to see the patients more as partners in that relationship is really important. So learning from patients, what matters to a patient, and also being able to talk about our profession to patients as well, such that we're raising our own visibility. So simple things such as hello, my name is, and I'm a radiographer today, and I've seen a fantastic poster out in your poster exhibition from someone there promoting the hello, my name is campaign.
Yeah.
It's the simplest thing that we can do as a profession, at putting someone at ease wherever we are, even if we're out of the service, in the public, networking amongst our own profession. Hello, my name is. And that simple introduction puts people at ease. It is that partnership, I think, and we need to then create opportunities for patients to be able to explain what it is they value from the service, what is causing them stress, what's worrying them, such that we can look at our patient pathways and think differently about them.
Yeah. And so how have you harnessed this within the Society and College of Radiographers in the UK?
So back in about 2007, we set up a public and patients liaison group.
Yeah.
And it was a small group to start with, but it had the leadership from council, so our president-elect, and real support with Secretariat to really try and consider how we could embrace the patient voice. And I think our ambitions were high. We're going to have patient voice across everything that we're going to do within the organisation. But you've got a limited group, the size of the group. How do you think about how best to utilise the voice? And I think what happened for us in the UK back at that time, there was some significant failings in one NHS trust, and we were able to involve the patients in our response to those recommendations that had been raised by government.
Yeah.
And so the patient voice and their patient perspective became really important. So I think engaging patients in our work, in those policy documents, has been hugely important, but also engaging them, say, for example, in our research work, ensuring the criteria for our research awards are having an impact on patients, have involved patients in the proposals, and then patients are involved in actually assessing some of those applications.
And you continue to have these patients on these advisory councils as well within the UK. Are there any ongoing challenges, I guess, that are recurring with this that you're kind of having to work through?
I think the challenge I've just mentioned is we would like a patient or a public representative on each of our professional advisory groups. You can imagine, I'm sure in ASMA, we've got about 13 formal advisory groups across the areas of radiography. And actually to have patient voice on all of those groups would be fantastic. But we've focused in certain areas on research, but also in our educational area as well, such that we offer education approval of the radiography programmes alongside the regulator. So having the patient voice within those processes has been really important to ensure the programmes are delivering patient-centred care.
Is it just the patient voice, or are you including parents, carers and things like that too?
We're broad. We're interested in I'm using the word patient, but we're interested in anyone who's experienced imaging and radiotherapy services, so either as a patient or as a carer, or genuinely has an interest in trying to make a difference and improve services for patients.
Yeah, great. So let's now talk about the Society and College of Radiographers Patient Advisory Group, which I believe was established in 2007. Who does this group consist of, and how do they influence policy?
So we've got very clear terms of reference for the group in terms of them being able to then set up a work plan for the group. The president of the Society of Radiographers and the chair of the College Board of Trustees are members of this group, together with some professional officers and the CEO of the organisation. They're a group of up to 9 representatives who really work and meet closely to have their own work plan, but also to consider how they can influence the work of the organisation. But all the officers within the organisation will also call upon the patient advisory group representatives to contribute to, say, consultations that we're responding to government, to bring that patient perspective to quite a lot of the different topics that we're working on.
Yeah.
And really, we haven't got enough to go round. We're writing policy documents that are for our members, for radiographers, and so having their voice and their perspectives on these documents is hugely important.
So one of these documents that I'm going to refer to now is the Patient Public Practitioner Partnerships Framework, a lot of P's there, which integrates the patient voices into the imaging and radiation therapy services. Tell us about this.
Yeah, this was a really important document which was initiated around about 2017, and we had a working group who came together for a day with charities and our patient advisory group to really consider how could we really support the profession best, both in clinical work, research and education. And this group had a real sort of brainstorming day and came forward with lots of ideas and thought about writing a document that was written in the first person. So as a patient attending service, I expect to be treated in this way. I really want to know what your job is and what you're going to, undertake for me during the time here. So written in that first person.
I like
really that. Great document. We published and obviously shared with our membership and produce posters for departments, etc. So that's been a really key and influential piece of work, but it's never as influential as you want it to be, is it? You publish documents and you think everyone's going to read this. So we're just doing a piece of work at the moment to refresh this, and my colleague Dr. Emma Hyde, Head of Education and Research, is leading this with Patient Advisory Group, such that we're taking account of the new documents that we've produced, our quality standard for imaging, our education and career framework, our changes to regulation. And then we're looking at how can we communicate this better with our profession. So we're looking at having some webinars, but also at producing an interactive tool, which is perhaps shorter and slicker than the very wordy document we had before.
Yeah, I like that. I think that would be what gets people to read it. I think it is something a bit more interactive, I think, too. So look, it all sounds incredibly fascinating. And so outside of the core framework, what else is there to help both the patient and the practitioner develop a good partnership?
I think this whole focus on working together, really key, and ensuring we have patient voice in most of our conferences and events, such that we're really embracing and really valuing that partnership. We've also produced additional documents that we will share with our members in terms of patient-centred care.
Yeah.
And one of the recent ones we've published, which is really interesting, the virtual support technology tool that is available now and being implemented. I'm not sure in Australia, but certainly some of the centres in the UK have implemented a virtual support tool where radiographers are delivering MRI scans remotely. And it was really key when we were developing this document. We thought, actually, we need to share this with patients. What do patients think about this tool? And it was really interesting feedback from them that, would you want to be informed that someone was undertaking your scan remotely? I think you probably would. I mean, obviously, you're going to have the appropriate care in the room, but it was very interesting. Would you need to know it's a radiographer? Who is it? I mean, our expectation, obviously, the professional body is it's going to be a radiographer and they're educated and trained to do this. But how do you feel about this? You haven't got the radiographer there. So really interesting.
Look, and I think that remote operation it's an incredibly hot topic at the moment anyway. What was the feedback from the patient?
Some said they wouldn't mind as long as they were informed, and they would need to know that the person undertaking the imaging was a radiographer, they were appropriately educated and trained, just as they would be in the service. Others felt quite nervous about it because they needed to be clear that the right support was there for them in the room whilst the remote operation was happening. And of course, that's something that we would recommend. So really interesting, but we were able to take that forward when NHS England held a webinar around this topic where we'd got a service promoting the value of remote operations, virtual support technology. And we were able to, quote the patient voice in this and the importance of radiographers really consenting patients when they consented patients for the examination, that they explained this was going to happen.
And I think the patient voice is also going to become more expected, I guess, when it comes to the implementation of a lot of things like AI, and with that kind of driving up quite a lot now as well, that's going to be a huge interesting point to be able to get the patient voice in there, right?
Absolutely. And we started to have some early discussions with the group around AI and what views would be from the patients. Would you want to know that AI was contributing to your examination or your pathway of care? And the voice was really strong. Yes, we would. So we've really got to build that in, because I think in a pressurised service, being able to explain that to patients either through information before they attend, that AI might be deployed alongside the human, obviously in the loop, making the final decision, but actually key that patients are involved and that we take time, I think, as a profession to ensure we're able to support that decision making. But interestingly, I came back from the European Society of Radiology conference in Vienna earlier this month, and there was quite a lot of discussion there with their patient advisory group around AI. And the importance, the message from the patients was actually it will give you time back to be able to offer us more care as patients.
That's a very interesting way of putting it, because one of the things that I've heard in the last few months is that whilst that's the way we would like it to go, where it means that we've got more time back to be able to give to the patients, what it's probably going to end up meaning, particularly from your bureaucracy side of things and people who like to look at data, is you've got extra time now. You can do more patients in that time. So you're giving the same care to the patient, but you're doing it more often.
I think we've got to, as a profession, we've got to respect, that we need to be able to provide the right support to patients. And so I think it's about influencing our leaders as well, and our policymakers about what radiography is. It's not just a simple come in, have an X-ray, push a button. It's actually, there's a whole process within there where we need to consent, we need to offer the risks and benefits, we need to talk about the next stages in the pathway. And life's more complex now. The imaging is more complex and care pathways are more complex. So I think we've got to create the time to do that.
And of course, our profession is constantly changing with the developments of technology and digital health. How do you ensure that the framework that we were talking about before keeps up with this?
Well, firstly, I think our education and career framework that we have, and with whichever country we're working within, needs to reflect the increasing use of different technologies. As a profession, technologies really are nothing new to us. We've adapted, haven't we, over the lifetime of our own profession, new technologies, new implementation of those, safe implementation of those. We've got to make sure that our career guidance and our career standards really keep up to date with that. We also need to be influencing our regulators as well in each country to ensure the standards are there to better support the education needs, such that the education needs are met for each professional that take account of this fast-moving technology. And I guess being here at ASMER, it's been great. I've just come out of a session on the use of AI in diagnostics. It's been really interesting thinking to case studies of how you implement AI and the considerations in terms of patient care, management of safety. Yeah, it's been great.
Oh, wonderful. Look, while I have you here, and I'm not going to let you escape without talking about this, I want to talk about your own reflections over the course of your career itself and how we can raise the profile of our own profession, because that's obviously been a huge topic that we've been talking about today. Over the years, you've worked as a diagnostic radiographer and therapeutic radiographer as well, and you've held many leadership positions in the NHS and private sector, and you've contributed internationally both through the WHO, through the IAEA on multiple projects. You have a very close association with the ISRRT at the same time as well. And for the last 20 plus years, you've been working for the Society and College of Radiographers. What is it like for such a prestigious professional organisation to work for them?
Well, firstly, I would say it's a real privilege to work for your own professional body. And every day I feel privileged that I'm in a position to be able to do this, to be able to influence and have the opportunity to work with our members who are doing such fantastic work, developing the evidence base, attending events such as this, really to learn and share and develop the profession worldwide. I mean, obviously our focus is on the UK, but we obviously work very closely at European level and internationally, as you've mentioned, with the ISRT.
Yeah.
So I think that privilege is important. I think the opportunity to work with so many different people as well. I mentioned members and radiography workforce, but also, you know, colleagues in radiology, in oncology, doctors in other areas, our fellow AHPs, really to learn from them and work collaboratively together within the health sector at the national level to, I guess, really influence the development of professional standards and ways of working and team working for patients, because that will make the difference.
Yeah. So how can the voice of radiographers be heard, and how do we raise our own profile in an industry that is very heavily influenced by other professions? And to give you an example, I was having a conversation with the other day, and I said that whilst medical imaging, I guess, in Australia fits under an allied health banner, I guess, for most states in Australia, I still feel sometimes like there are almost 4 tiers within the hospital. You've got your doctors, you've got your nurses, you've got your allied health, and then you've just got medical imaging on it, kind of on its own. And it's almost just like it sits as a bit of an outlier there. So how do we raise that profile in this industry?
It's interesting you've raised that. I mean, just thinking and relating what you've just said back to the UK, you know, our members say all policymakers talk about doctors and nurses.
That's right. Yeah. Well, not just policymakers, media. Media talk about it all the time as well.
That's true. Politicians as well.
Yeah.
I think we firstly have to, as I mentioned earlier, talk about ourselves. We have to say, hello, my name is, I'm your radiographer for today.
Yeah.
That's a simple thing that if you think, say in the UK, we've got 40,000 radiographers. If every radiographer said that at every interaction, then that starts to raise the profile with the public. But I also think some of the campaigns that I've seen run through your own organisation, which you're promoting, that ASMER have done in terms of posters and really articulating what value you bring is really important. But I think as a professional body, in my role and the role of others within the professional body in the UK, it's about raising our profile. It's making sure that the descriptions that our professions mentioned in policy documents, that it's better understood and articulated. And I think we just need to keep doing that. I think it's really challenging, but every radiographer has an opportunity to do it. And I think we need to do it through, hello, my name is, I'm Charlotte, I'm your radiographer.
Yeah, absolutely. And look, I think that the Vox Pop that ASMER did in 2025, one of our staff members actually went out to different people in the public just to ask them about what they, you know, who was it that took their x-ray. Quite eye-opening to see the responses that actually came, because very little of them. In fact, I think one of them was actually a radiographer that actually said, yeah, I know a radiographer does it because I am one. So, but other ones were very surprised to hear that they hadn't even heard of a radiographer. And so for someone that works in a small department in an organisation that doesn't necessarily include the patient voice, what can they do to include the patient voice as an influence in how they work in their profession?
I think everyone has the opportunity, and I think trying to work within a department, gathering patient feedback is really important. So even every interaction that you have with a patient, understanding what matters to them, and has that investigation, is there anything more I could have offered you today that would have helped? So getting some direct feedback. I know it's time consuming potentially, but actually finding an opportunity to do that. Having feedback questionnaires in departments, really important to be thinking about how we can learn quickly from our patients, I guess, through a quick QR code. How was your experience today? What did you learn? So I think those sorts of things really make a difference. And then perhaps being able to set up small groups of patients to come together when you're introducing something new in a department to say, actually, we want to hear your views. Can we talk to you about this?
Yeah, absolutely. Charlotte, thank you so much for taking the time to join us for this podcast today. It's been quite inspiring talking to you after all that you've achieved in your career so far, and how much you and the Society and College of Radiographers in the UK have really thought about including the patient voice. I think that, you're really leading the way in this as well. For all of the listeners out there, what do you think that they can do in their own practice when they get to work for their next shift?
Go in there, talk to the patient, ask them what matters to them, what they hope to get from this examination, and introduce themselves as, hello, I'm your radiographer. And I know I've mentioned that a few times during this podcast, but I think it's really important. But I think watching a patient's body language, trying to read how someone is feeling about that examination, and looking at carers and just trying to really be empathetic and compassionate towards that patient and what they might be feeling is hugely important.
I think the hello, my name is an incredibly great place to start, really, because that's how you would introduce yourself to most people anyway, right? So, Charlotte, thank you so much again for your time.
Thank you very much. And I'd just like to say one last thing, if there's time.
Absolutely.
Just to really thank all of members of our patient advisory group who are doing some fantastic work on a voluntary basis, who continue to commit to helping us. Without them, we wouldn't be able to move forward in the way we have. And my second thank you is to ASMERT for the really kind and generous invitation, for inviting me over to Tasmania, Hobart, to be here. Fantastic. So I'm really looking forward to the conference, and thank you.
You couldn't get further away from the UK than Tasmania, that's for sure. So no, we've really enjoyed having you here, and thank you so much for coming over.
Thank you.
Thanks for listening to Radpod, a podcast produced by the Australian Society of Medical Imaging and Radiation Therapy.